Hello, my name is Minara Ali, and I'm excited to introduce GallDetect, a non-invasive solution for gallbladder cancer detection. I first want to tell you the story of Susan, a hardworking woman living in the rural Midwest, USA. Like many, she experiences mild discomfort in her upper abdomen. While she doesn't know it, she's dealing with the early stage of gallbladder cancer.
Gallbladder cancer is one of the most deadliest cancers, not because it's untreatable, but because it's diagnosed too late. In Susan's community, advanced diagnostic tools are out of reach. The tests available to Susan are either invasive, expensive, and often inaccessible. Currently, diagnosing gallbladder cancer relies on invasive and costly procedures like MRIs and biopsies. Additionally, there's a lack of healthcare infrastructure in rural areas.
Susan isn't the only one facing this challenge. In fact, the total addressable market for gallbladder cancer is 51.6 million. The serviceable available market focused on diagnostics is 31 million, and our initial goal is to capture 10% of that market, representing a $3 million annual opportunity.
Our solution is GallDetect. Simply stated, it is a pill and an app that work together to change the game. An individual simply has to take the pill, which has nanosensors and AI technology to analyze saliva samples for biomarkers that indicate gallbladder cancer. Then, the data is transmitted via Bluetooth to a companion app, providing instant results. This means Susan can perform a test at home for just $15, a fraction of the cost of current methods.
This is how GallDetect works under the hood. The nanosensors in our pill bind to specific microRNA molecules that have been shown in research to be linked to early-stage gallbladder cancer, thus serving us potential biomarkers to target. This generates digital signals that are sent to our companion app. In this app, a convolutional neural network then interprets these signals. GallDetect's total manufacturing cost per test is $8. About $5 covers components like nanosensors, pill formulation, electronics, and packaging. The remaining $3 goes to overhead costs, including assembly and regulatory compliance.
We can compare GallDetect to existing options based on two key metrics: the cost and the effectiveness of the diagnostic tool. Ultrasounds are available but often ineffective. MRIs are very effective but are exponentially expensive. Biopsies are definitive but invasive and costly. GallDetect is the only affordable, non-invasive, and accurate solution, filling the critical gap in the market. So far, our progress in product development has led to collaborations with researchers at the Johns Hopkins Institute for Nanobiotechnology and AI model training that show roughly 95% accuracy in biomarker identification.
Moving forward, we have a three-phase plan for GallDetect. In Phase 1, we will finalize clinical validation and product refinement. In Phase 2, we will secure regulatory FDA approval and conduct large-scale trials. In Phase 3, we will launch GallDetect, with our first consumer being Susan. Here, we can see our projected cash flow through our phases from 2035 to 2035. Early on, we're investing heavily in research and development and regulatory approval, leading to negative cash flow until around 2031. During this time, we will be dependent on grant income. As sales ramp up and we reach the market in Phase 3, we anticipate breaking even by 2032, then transitioning into positive cash flow.
Before GallDetect, Susan lived with uncertainty and limited access to healthcare. She couldn't afford an MRI or wait weeks for a diagnosis. Now, with GallDetect, she gets quick, reliable results, giving her control over her health.
Behind GallDetect are two like-minded high schoolers. My name is Manawer, and I am the head of business for GallDetect.
My name is Sahil, and I am the head of research for GallDetect.
GallDetect, detecting the signs, changing the outcomes.